Diane here.
I'm not sure who is on the phone.
Diane Cox.
Thanks, Diane.
All right. Well, if everybody can hear me, then I guess we're going to go ahead and get this meeting to order. So I'm going to call this meeting of Health and Human Services to order on Thursday, August 12th at 10:31 a.m. Was the meeting properly posted?
Yes, it was.
Wonderful. And I would entertain a motion to approve a 17-point agenda.
So moved, Tim Gatchell.
A motion by Timothy Gotchell. Is there a second? I see Cindy Chicker raising her hand. So is there any further discussion on the agenda? Hearing none, all those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. Are there any additions or corrections to our July 8th, 2021 board minutes? Hearing no additions or corrections, I'll just declare that those be approved as presented. Number 3, do we have any citizen comments? Any citizen comments? Any staff or board members want to comment on anything? Hearing none, then we'll move on to agenda item number 4, director's report. Tracy?
Thank you, Mr. Chair. So, pardon me, late in July, the CDC guidance changed to advise masking in indoor public settings regardless of vaccination status if you're in an area of substantial or high community transmission. So this change came about because of the Delta variant of COVID, because it's so much more infectious, excuse me. So on August 1st, Health and Human Services returned to requiring staff to wear masks in all parts of our building and when meeting with clients, regardless of their vaccination status. This was in response to Richland County being identified as an area of substantial community transmission. Our county's level of community transmission has since increased from the substantial category to the high category. Also, as a result of this, the Emergency Operations Center will begin regular weekly meetings again with the key emergency response partners to ensure coordination of our response to this status. We are also moving back to holding fewer in-person group meetings within the agency and shifting back to using Zoom meetings more frequently. Our Health and Human Services Board meeting today was switched to Zoom only because of the changing concerns with the virus, but also because of some logistical reasons. The county boardroom was not going to be available for us today. And our Health and Human Services conference room does not have the sound system capabilities to ensure that virtual attendees can hear the discussions. So before the board adjourns the meeting today, perhaps you might want to determine if you would like to continue meeting via Zoom exclusively while the county is in this substantial or high community transmission level, or if you want to resume the in-person meetings with the option to attend virtually. So I'll leave that to the board to give us some direction on. In terms of program news, the Alive and Kicking event that was scheduled on August 26th has been canceled due to the increase in COVID cases and transmission level of the virus in the county. The ADRC will be looking into when it's appropriate to reschedule this event. The ADRC will be hosting a public hearing in order to receive feedback for developing the county's 3-year aging plan. The meeting will be September 8th at 1 o'clock in our main conference room, but there will also be a Zoom option to participate. Child and Youth Services staff continue to be very busy with increased reports, investigations, and placement needs. One of our case manager vacancies has been filled, which will help with the workload, but it will take many months of training before the new staff can perform all of the responsibilities of the position, after hours on call duties in particular. We are still recruiting for the other vacant position in that unit. We have seen a roughly 10% increase in the number of referrals to our Birth to 3 and Children's Long-Term Support Programs compared to this time last year. So staff are certainly keeping busy there. The Coordinated Services Team program anticipates a new parent peer specialist starting in the next 2 months. This will be through a contract with Wisconsin Family Ties. The parent peer specialist will be able to help provide additional outreach to support families and parents of youth who have multiple and serious challenges in their lives, which impact overall emotional, physical, and social well-being. All behavioral health staff workloads remain high due to needing to cover the adult protective services and crisis duties until those vacant positions are filled. We continue to recruit for them as well. In economic support, the food share, Badger Care, and Medicaid programs continue to operate with more relaxed requirements, with many of the timelines extended or waived. But verification of income and other eligibility for new enrollees has been reinstituted for these programs. For those enrolled in Badger Care Plus or Medicaid, they will not lose their coverage if they do not verify required information. This is a protection that is put in place to ensure that no one is left without health coverage during the pandemic. There may be a new assistance program that will soon be available to households. The state of Wisconsin has submitted a plan for the administration of a low-income household water assistance program. This would be a new federally funded initiative to provide eligible households with assistance with their household drinking water and wastewater or sewer service. We'll share more details with about this program once the plan has been approved. And Mr. Chair, I believe that's all I have for my report today.
Thank you, Tracy. Is there any questions from any board members on her director's report? All right, we'll move on to agenda item number 5. Health officer update. Rose?
Yes, thank you. Good morning. As Tracy mentioned, the Delta variant has definitely had some impact on the operations of our building in particular, but also in the recommendations that we have been providing to the community as well. And again, indoor masking of all individuals, given our dubious distinction of being an area of high COVID-19 transmission, is something that we are advising just to help reduce that spread. The Delta variant is a different animal. That's how it's been described. It tends to be able to infect folks much more effectively and efficiently with a lower concentration of virus. Its mutations allow it to latch on using its spike proteins very effectively onto healthy cells, whereby it can replicate. And once it replicates quickly and exponentially. So the ability to become infected and then in turn infect others happens much more quickly. There's a replication value, or it's also referred to as an R0 value, that indicates that in ancestral strains of COVID-19, maybe 2 to 3 individuals were very effectively infected by a person who had come down with COVID-19 or who was infected. But with the Delta variant, we're looking at an R0 value of 5 to 8 individuals. So when you think of how much more quickly that can spread, that's definitely reason for concern. I know that, Tracy, you have the information on the case statistics or on the Richland County COVID-19 statistics available. It'll give you information regarding our most current information as of yesterday. And I will let you know that we have had one additional new active case added as of yesterday afternoon. So we are at 26 active cases right now, and probably at least that many, if not more, probably closer to 30 to 35 contact investigations. So running close to 50 to 60 cases of work, although 26 of those individuals have active COVID. But this gives you some information on our numbers as of yesterday here in Richland County.
Rose, could I ask a question?
Yes, go ahead.
On the number where it said total ever hospitalized, I'm just curious if when you guys report them as hospitalized, is it reported as hospitalized if they're hospitalized due to COVID, or is anybody who's hospitalized who tests positive for COVID marked as that? And the reason I ask is because I work in birth center, and we tend to get patients who will test positive but are completely asymptomatic, or, that's not the reason why they're there, obviously.
Mm-hmm. I'd have to take a closer look. The information we receive comes directly from the Department of Health Service, and they have a vetting process that they utilize for making that determination. That's a good question, and I'll have to look into it in more depth to find out exactly what their particular thresholds are for making that determination. It may be, again, I can see the distinction completely, that a person goes in for something else, or is tested at the time or just prior to admission, and they test positive, but is that the reason for their stay? So I'll do some checking on that.
I'll add just, Rose, the statistics that I just shared on my screen is in your iPad folders. And we do update that once a week and send out to our relevant partners with the EOC.
Right, it's got all of our vaccine activity, it's got our cumulative case activity, it's got a breakdown by age group, and we differ from the state, surprisingly, in that the state usually has recorded more cases than those aged 20 to 29. But here in Richland County, the highest age group for case activity is those ages 50 to 59, and that's followed very closely by those who are 40. Hang on, I gotta look at this. It's 40 to 49. So yes, you can see that there. So we are slightly different in the way our cases tend to align by age as opposed to the state. And then we're continuing to keep a very close eye on things. With our nutrition program, our sites do remain open, although we're doing our best to try to keep folks distanced, and then also wearing masks, except during the times when folks are eating. So we're just being very careful and very prudent. We just don't want to be in a position to host an event or to permit an event that we have direct, control over, for lack of a better way of putting it, and then have it become an event where transmission or an outbreak occurs. So we're just being very prudent and very careful in our approach, given the local conditions that we're seeing.
Rose, I was wondering if you could help me understand some this information here. So in November of 2020, it looked like we had 374 cases.
Mm-hmm.
Currently in August, you have 26. and we're at a high level of transmission, what is the threshold for that level of high for transmission? Because if we have a population of 16,000 people, I think 374 would be a high level. Why is 26 considered high level?
They look at it. They look at it in different ways. They look at it based on per capita. They look at the amount of cases per capita. Then they also look at the numbers of folks who are tested, and they also look at the numbers of individuals who test positive of that number. So if you've got 100 people that are tested, and then 26 come up positive, you know that's a certain level of positivity rate, for example. But and then they also the state also looks at it, and then the CDC, and that's where the transmission map comes from. You'll see it here. They actually look at it both per capita, and then I believe the state looks more closely at the percentage of those who test positive of those tested. So they look at it two different ways, and it just shows, and that's their only way of getting that particular data.
And then is there a way that we could get some more information like regarding yearly? So like, could we get the number of hospital stays from like January of 2021 till current instead of having a running total? I think we could have a running total, be nice, but it would just be nice to see like how many are hospitalized in 1 month or each month. So then I think people know a little easier. I'm like, what's really happening then?
Right.
Transmission is high.
I know that these case statistics have been provided probably almost on a weekly basis for a long time. I do have those available, and we could take a look at, you know, what it is from month to month. We'd have to look at those that are reported each week of the month and then count them and go from there. It would be a manual process. I also have the December 31st case statistics as well, so we can kind of tease out where things ended in 2020 and what activity we've had here yet in the year of 2021. So we do have that available.
Excuse me, Rose, I think that the information that I download when I download the state data, that probably could be pulled out a little more easily than you having to manually do it, because they do give that on a day-to-day basis. And I think we have every day what our hospitalization status is. So yeah, we could pull that out.
Mm-hmm.
My thought was too, Tracy, to go with that is there's the Richland County snapshot on our website, Richland County website. Can we just add another block with the dates for this year or something? Listing this year's and how many total hospitalized?
Yeah, we can take a look at a good way to display that. That's a good thought.
Again, I do think it's an important distinction to distinguish between, are they hospitalized with COVID or for COVID, because that paints a different picture. And just anecdotally from when I've been working, again, in my unit particularly, we see a fair number of positive cases where obviously they were not admitted for that and have no symptoms or few symptoms.
You know, I can concur with Ingrid. You know, with me working in the emergency room, you know, for example, I had a patient at one time that come in and was diagnosed with appendicitis, and it's a requirement that they get a COVID test, and this person ended up being asymptomatic, but they really were admitted to the hospital because of appendicitis. Acute appendicitis, COVID was like secondary, and so.
Right. Yes, I'll get some definitions from the state regarding kind of what their process is for making that determination, and then I can get that information to Tracy, and then we can get it distributed to folks regarding that.
Is there any other questions for Rose? Concerns?
I don't have a question, but I just would like to commend Rose for her radio spots. I think she does an excellent job. She informs the public. She's very clear, provides the information in a very understandable way. So I think she's doing an excellent job with that.
I appreciate that, and thank you. I think the fact that I just show up every day might have something to do with that. And I'm so close to retirement. Thanks.
Thank you, Rose. Let's move on to agenda item number 6, review and approve our Health and Human Services vouchers. Is this something that Stephanie's doing now?
Angie's gonna pick this up for this
Okay.
month.
Yeah. So if you would go ahead and display, great. Note that because we're in virtual mode again, I'm going to be sending you guys all an email after these are all approved for the $40,535.29. So then I can send those email verifications off to the county clerk's office like we usually do instead of that handwritten signature page. So yeah, so there it is up there, $40,535.29. So we'll go on to there. Next page was mileage expenses. That continues. So those are the mileage expenses for the month of August. Goes through page 3. Yep. And then we'll start vouchers on page 4, which I have some noted that are a little different. Vendors or things that we've purchased. So right at the top, BL signs for $191.25. Voucher number 68 it was for a banner for the ADRC. They purchased that recently. A little further down in the middle, there's a large voucher number 37. Card member services is our credit card charges, and there's that $1,325.76. That's our usual monthly fee for our electronic health record system for the behavioral health programs called Cario. So that's a reoccurring large charge, but on our credit card. It's all I had highlighted for page 4. Or wait, no, I did do one more on 4. Sorry, 47. I noticed that when I didn't know what that was, the $475.74. I looked that up. That was 3 digital data loggers for public health vaccines. So I thought that was a little different and a little higher charge. So I thought I'd highlight that today. So then if we flip to page 5, number 44, right in the, yep, right there, $527.49. If you notice that says the FSP client services, that is a client purchase a baby stroller that does get reimbursed through our CCOP program. And voucher number 47, I did. Okay, then number 4 and 5, way at the bottom. Those are the GFC leasing. That's our 5 copiers that we lease here in the agency. That's the monthly fee and the actual copy fee. So the monthly fee is the $732.32, and then our actual copies we made for the month, $357.66. We flip to page 6. Number 51 and 52 right at the top, Johnson Controls. 51, the $1,647.78. That is a fire alarm and sprinkler inspections that were done as of August 31st. So that was getting us caught up for those inspections. And 52, right below that, the 210, is just a semi-annual fire alarm monitoring fee. So those are all for our sprinkler systems. Number 9, way at the bottom, for $788.48, Nutrisystems Corporation. That's more purchasing of thermal bags for the senior nutrition program. And then we can flip to page 7. Page 7 has a lot of our Quill Corporation, which is our office supplies purchases. The first one at the top, number 10, is for $449.85. That is copier paper. We usually try to keep a number of cases here in-house. So we got that caught up to the number we like here, about 30. Page 8. Towards the middle and all the way to the end, the Richland Observer, lots of advertising done again this month, to the tune of $876.70, largely vacant position advertising that needed to be done. Page 9. The only one I have highlighted here is number 55, right in the middle for $215. And that's just because it's a conference. And we haven't been doing a lot of conferences, but we did have one employee able to attend or will be attending an in-person conference in Green Bay. So that is for Stephanie to attend the financial managers conference. And if we go to page 10, those are the previously paid. And the only one I have note here is the one at the top, number 1, the quarterly bill for $2,125. That's for the environmental health consultant fee that we have to share Troy Morris here in our department. Any questions that I can answer?
Hearing no questions, then somebody like to make a motion to approve our vouchers for this month?
So moved, Tim Gatchell.
I move we approve the vouchers for the month.
So we got a
Cindy
motion
Chicker.
by,
Second.
got a motion by Timothy Gotchel to approve our vouchers for the month and seconded by Cindy Chicker. Is there any further discussion on our vouchers? Okay, all those in favor of approving the vouchers signify by saying aye.
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 Aye. Those opposed say nay.
Aye.
Motion carries. On to agenda item number 7, 2021 budget summary and county placement report.
Thank you. I'll take this one, Mr. Chair.
Okay.
As you will hear, Stephanie has been selected as our new financial manager, but her first day was Monday. So Robin did a fair amount of training before she left, and so I put this together. And once Stephanie's had a chance to work with it, if there's been anything that I've missed, we'll be able to kind of go over that with Robin and kind of get it corrected. This month, you should see expenses hitting around the 58%. That's where we would hit through the month of July. Generally, you'll see that the majority of our expenses in our programs are below that, and a big driver of that is the vacancies that we have been experiencing this year. I'll draw your attention to public health, of course. As you know, public health has been very busy, and we are exceeding our expenses in public health due to our response to the pandemic, but there is funding that is covering those expenses. And I'll also highlight CCS is also an area where we are exceeding our expenses, but we are also receiving revenue that covers that, and that's primarily driven by increased services to individuals in the CCS program. Any other places you may see some areas where we are pretty low. Again, the vacancies are one driver of that, and other drivers might be that the service use is down as well. If there are no questions about expenses, I'll move on to just talking about the overall revenue and picture of the budget. So in the middle table here, you can see that our anticipated revenue is $3,942,080. That's with the received revenue from the first table as well as some anticipated revenue. Our expenses, excuse me, I misstated that. I was referring to the first table, which is expenses, not revenue. You can tell this is not what I do. So the expenses come from the first table, and then any unanticipated but not yet received expenses are $3,943,404. So that leaves our budget in a deficit of $23,324. But again, mental health institutional charges do get charged initially by pulling our allocations for our programs. And so with the chargeback back to the placement funds, our budget stands at 59,501 to the good. So that's the second highlighted number here. Are there any questions about the current status of the budget? I'm sorry, I'm probably not as good at explaining it as Robin was.
Tracy, when you said that we get some outside funding for public health, is that figured into our either revenues or minus from our expenses?
Yes, it's included in our revenues. So when you see that the expenses are above what we budgeted, we're getting revenues that also offset that. So when it says anticipated or received revenues, those would be included there. Any other questions related to the budget table?
You can go ahead and do our placement report.
Right. So in the placement report, you'll see that in adult institutional and inpatient placements, we did have some utilization, although not quite as high as some previous months. We ended the month of June. Again, we do this through June rather than July because we don't have all of the data to give you July yet. The year-to-date adult institutional expenses was 82,816. Our crisis stabilization expenses were 47,147. And I'll move on to the adult community residential placements. That has stayed fairly steady, although you'll see that there was one additional residential placement. We moved from 8 to 9 there. So we end the month of June with 266,162 in expenses. So for Fund 54, which is our adult placement fund, we started the month, we started the year with 482,278 in that fund. We have expended 396,125 through the month of June. And so that leaves 86,153 in that fund. With child placements, our child institutional and inpatient and detention placements, not a lot of new activity there. The institutional expenses ending the month of June was 96,475. Juvenile detention, there was a little utilization in June. That ended at 23,400. And with child foster care and treatment foster care placements, the last couple of months, we certainly have seen an increase in placements. In group home and treatment foster care, we are now at 208,270, and in regular foster care, 14,527. So in Fund 44, which is the child placement fund, we started the year with 527,341. We have had 342,672 in expenses as through June, leaving 184,669. I'm gonna give you some broader snapshots. So in comparison to previous years, this just shows the month-to-month comparisons. The dark blue again is this year, and as you get into the lighter shades, those are previous years. You can see that June was a little bit less than previous years, but we still are trending pretty high. In terms of just how our expenses have gone through the years. We are trending to end the year at 1,462,000 roughly, if the placements continue as they have for the first 6 months of the year. And just to give you a sense of what that looks like with the different placement types, the institutional inpatient types are down. They are trending to end the year about 165,000, which is less than what it has been in the past. Adult community placement expenses is trending higher. And again, that's really a result of one very high cost placement that has allowed us to keep an individual out of the institutional placements and does receive some CCS Medicaid revenue to help cover that cost. Adult crisis stabilization is more utilized, and as I've said before, we do want to see that because individuals being able to be in that level of placement can help either deter the need for inpatient hospitalization or shorten the need for it when it's used as a step down. With child institutional and residential placements, that is down a little bit, but generally pretty steady at trending to end the year at 192,000. Juvenile detention expenses is likely to end the year right around 31,000. It had been high previously because of a long-term placement there. Group home and treatment foster care, that's where we're seeing the big increase for child placements. And then regular foster care has remained pretty steady. Are there any questions about placements?
All right. Thank you, Tracy, for giving us that update. Let's move on to agenda item number 8, our 2021 contract monitoring report.
Okay, back with me. There's the report. Okay, so found bills mostly through June that vendors have been billing us, which is a 50% utilization for the year. So far right column, I'm looking for anything over 50%. So there's a few on the first page. Children's Hospital of Wisconsin, fourth from the top, is at 50, a little bit above that, Tracy, 51%. That, though, notice they have billed us through July. So that should be trending okay, as well as Cholita just below that, again, over the 50% mark, but they have billed us through July as well. Couple down from there is the Fond du Lac County Department of Social Services. We are at 92% utilization. They did bill us through July, but as Jess has been saying, she doesn't anticipate using them again. I did find one bill, Jess, for July recently, so I'm going to continue to monitor those and not put that we're invoiced through December yet, just so I can keep a closer eye on that one. 2 up from the bottom is Positive Alternatives at 65% utilization. And I think Jess is anticipating not using them much. So those should trend okay. Page 2. Everything on the far right is well below the 50% utilization mark. Page 3. Just down from the top, Premier Financial Management Services is at 96%. Their $100,000 is one of the items that's on our agenda next to be amended for to $175,000. We're hoping that should trend through the end of the year. Page 4. Right at the top, Cornerstone Foundation, doing business as Lucky Star. It's at 74% utilization. They're another one that's also on the contract amendments agenda item. They have only billed us through May, note, and the contract amount is $150,000. We did have another individual placed there. Miranda will talk about that a little bit more as to why the $305,000 an additional increased amendment to that contract. She'll talk about that on the next agenda. 4 down from that, the top is driftless, just tipping over that 50% mark. So we'll just continue to watch that because that's a big dollar amount one. Page 5. Our normal carryo right at the top is at 55%. They billed us through July. Nothing else on page 5 that is out of line. Page 6. Just a few down from the top, Tellurian is at 79% utilization, and that's another one that's on to be amended from the 49.5. We're looking to amend that to $120,000. And then 3 up from the bottom, Vista Care is at 57% utilization. That's a little concerning. I know we've been looking at that, watching that one closely too, obviously, because it's such a high cost placement. So just wanted to point that out for you guys. That's all I have for contract monitoring. Any questions that I could answer or concerns? Basically at the halfway point, even though it feels like we should be finishing, you know, getting towards the home stretch, we're really just right at June monitoring with bills coming in.
Okay. There's no further questions then for Angie on our contract monitoring report. And let's move on to number 9, our contracts, amendments, and agreements that may need to be approved.
Yeah, so these are the 3 we've been watching and talking about the last few months. I was able to meet with all the different management staff to talk about how large they're looking at amending. They are all on county board for next week if they're approved here. So the first, well, actually all of them, if Miranda's on, she could probably speak to all 3.
Sure. So Cornerstone, when we planned for that contract last year at this time, actually, we were getting contracts ready for 2021. And at that time, we had actually 2 individuals placed in Cornerstone, getting the psychosocial rehabilitation services or CCS services. So it's partially reimbursed and partially tax levy due to 2 more people wanting to move closer to the community here and look at reintegrating. We have actually 4 individuals placed at Cornerstone. So that's the reason for the increase, I believe, from $150,000 to $305,500. And then Premier Financial Services is our children's long-term support fiscal agent for those parent-directed or self-directed supports for individuals or children needing those services in their home. And also it's based on children's needs throughout the calendar year. So we start out with a baseline, what we expect it to be, and then we're requesting that increase based on children's needs throughout the calendar year. Tellurian is our crisis stabilization facility as well. They contract with us for detox services, but the reason for the increase this year is, as Tracy talked about in placement, we've used more crisis stabilization this year, trying to get people out of the institutional stays a bit more quickly to that lower level of care as they either move on to an AFH or back to the community. And that is partially reimbursed by insurance or Medicaid for those who have it. Any questions that go along with the contracts?
So hearing no discussions on these contracts, you do this all separately, right?
I believe you, because they're all amendments, I believe you can do them all as one motion.
Okay. So would anybody be interested in making a motion to amend our contracts?
I can move. This is Ingrid.
Ingrid Glassbrenner moves to approve our contracts, our 3 contracts. Is there
Second, Van.
second by Van Nelson? Any further discussion on our contracts? Right.
Just one question
Dr.
for
Barris?
Miranda. On those 2 other people that were moving into the first program, are they moving out of another program that we're going to save money on that, or where are they coming from?
Yeah, that's correct. Actually, that's the case for both. They were placed in AFHs farther away or in other facilities. So they're still in the CCS or Comprehensive Community Services Program, but just physically got a little bit closer to Richland County.
Thanks.
And Miranda, since you said CCS program, then are we reimbursed?
Is partially reimbursed, yes.
Reimbursed, okay.
Any further discussion? Hearing none, a favor, voting aye for this would be moving this on to county board. So all those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries. See, we have a new little guest that joined us.
Sorry.
Do we have anything else on any agreements or amendments to anything?
No, I don't believe so.
Just those 3? Okay. Then let's move on to agenda item number 10, personnel updates.
All right, well, we do have quite a few updates to share with you. There is a memo in your iPad folders. I'd like to announce in terms of new hires that Deb Dittmer, who had previously been in the economic support unit, has moved into a position as a fiscal specialist. Veronica Olsen, who had been LTE admin staff for public health, has been hired into one of our open secretary positions. Shelby Miller is one of the new child and youth case managers. And Stephanie Ronfeld, our former economic support manager, has now been hired as our new business and financial manager. In terms of probationary period completions, Alice Meyer is a temp casual nutrition worker. She has now completed her 910 hours of required work time to complete her probation.
Tracy, I got a
And-
question.
Yeah.
How long did it take her to complete that 910 hours?
Oh gosh, I don't have her height.
I can look that up. I can look that up.
Okay, Angie will have that in a couple of minutes. I'll jump down and share some additional information, and then Angie can pipe back in. So that's all of our county employee news, I believe. We do have one resignation to announce. Alice Lawrence Retram, our psychiatric nurse, has submitted her resignation. She will be done as of tomorrow, unfortunately. So we will be advertising for that. You'll see in the memo that Alice has agreed to stay on to help as a leased employee with our outpatient psychiatric services. So she will be putting in some hours to help continue supporting that. Veronica Olsen is resigned from that leased position that I mentioned, and now a county employee. And as you know, I think from last month, Robin Hampton, who had resigned, we did hire Robin back to help provide some training and support while Stephanie gets on board. And then we have several vacant positions, as we've discussed. I'm going to put those on the screen so you can see them. So we do have one driver position for the ADRC. We do have a adult protective services worker position. That new APS crisis professional position that we have had created for 2021, we have not been able to fill. We have 2 mental health therapist vacant positions, and now 2 psychiatric nurse positions, and 1 child and youth services position, and 2 economic support specialist positions. We are currently advertising for all of those positions, but with the economic support specialists, we aren't extending those advertisements right at the moment until we have the new economic support manager on board. Fortunately, because of being part of the consortium, we're not pressured to try to hurry up and fill those. Are there any questions about the personnel updates?
Just a congratulations for Stephanie.
Thank
It's a hard
you,
job.
Kim.
So I've
Yeah,
heard.
thank you. Thank you.
Yes.
Oh, we'll see.
Mhm. I have that date for Alice Meyer, if you guys want that.
Yeah.
She started December 16th, 2019.
It's a long time.
2019, huh? Okay, well, let's move on. There's any other questions about our personnel updates? Okay. Agenda item number 11, approve the Coordinated Services Team Initiative Grant. Miranda?
Yes, so this grant, we've actually been working with since 2014, and really the county staff have been trained on this longer than that. Wraparound services for children. The grant total that we could get up to from the state would be $60,000. And then if we expend all that, we would have up to a $12,000 match, or 20% match. Part of that that we talked about earlier was we are having a new parent peer specialist start from Wisconsin Family Ties. I think she'll be starting towards the end of September. That really helps youth and families that have those complex behavioral health treatment needs come into the services system, and then hopefully work with community supports so they don't end up in higher level care systems.
All right, committee, you heard background for this grant. What are your wishes? Motion would be appropriate to forward on to county board for approval of applying.
I so move.
Second.
I so move. This is Cindy.
We got a motion by Cindy Chicker to have the county apply for Coordinated Services Team Initiative Grant, seconded by Dr. Barris. Is there any further discussion on this grant? Hearing none, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. Next on our list is agenda item number 12, approve a state opioid response grant.
So this grant as well is a grant that we're working under, working on that intensive outpatient programming that is used to meet with individuals that struggle with opioid use disorder. The state is opening that up through a SAMHSA grant that has come down to the state to include stimulant use disorder. I think it's important to note that the methamphetamine use has really increased in Richland County in the last 2 to 3 years. This grant doesn't have a match total, so it's this time we requested up to $149,000. As part of the grant, we do have a contract with Southwest Wisconsin Community Action Coalition, or Southwest CAP, actually. Actually, I see it in error. It's actually Southwest CAP, it should say in that language, that will be having peer support specialists. They had come into the community under a previous grant, reached out to those individuals struggling with overdoses and giving them pretty immediate services to help get into treatment. And then we do have a treatment provider here that works under the SOR grant. So the current grant we're under will be ending on September 29th. And then the new request will be to apply for those grant funds from September 30th to September 29th of next year.
All right, committee, you heard the background on applying for our state opioid response grant. What are your wishes?
This is Van. I move to approve.
A motion by Mr. Nelson to approve the state opioid grant, seconded by Diane Cox. Is there any other discussion, further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Those opposed, say nay. Motion carries. Moving on to agenda item number 13, approve 2020 section 35310 vehicle operating grant.
Yeah, I think Roxanne wasn't able to be here this morning, so I'll take this. So this is an application for that 5310 vehicle and operating grant. It will allow us to capture $29,000, a little bit more than $29,000 for the transportation program. I believe this is a grant that we regularly apply for. I should mention there is a match to this grant, but that is budgeted.
Okay. So we heard the background. What is the committee's wishes?
I'll move to apply for the grant.
Motion by Dr. Barris to apply for our 5310 vehicle operating grant. Is there a second?
I can second.
Seconded by Timothy Gotchel. Any further discussion?
Just a point of clarification, part of that match can be in kind as well.
I believe that's correct.
Yep. Okay.
Any other discussion? Hearing no other discussion, I'll call for a vote. All those in favor signify by saying aye.
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 Mr. Nelson gives a thumb up, and all those opposed say nay. Motion carries. Moving on to our next agenda item, number 14, approve a new commission member of the Aging and Disability Resource Board.
All right, again, so I believe Sharon Knutson has retired from this board, and so this is a request to appoint Joe Scribbins to the Commission on Aging and Disability Board.
Is Joe an employee of the county?
No, he is not.
Okay. What is the committee's wishes? Anyone willing to make a motion to approve Joe Scribbins? for
Van, I
county
so
board?
move.
A motion by Mr. Nelson. Is there a second? I will second that motion. Is there any further discussion?
Chair, Joe works for Schmidt Woodland Hills.
Okay. All those in favor signify by saying aye.
Aye.
Aye. Opposed, say nay. Motion carries. Moving on to agenda item 15, approval of a purchase of computers.
Yeah, this is a large purchase request. We, as an agency, we maintain over 100 computers. I think 103 is the actual number last count. 53 laptops and 50 desktops. This request is to replace 26 computers, 24 laptops, and 2 desktops. Recognizing that next year is going to be a tight budget year for us, we are wanting to take advantage of funding that we have available this year, as well as various places that we will be able to charge and capture revenues or funding to help cover the cost. MIS recommends that computers be replaced every 5 to 7 years, more on the 5-year end for laptops, because they tend to not last as long because they're transportable and there's greater chances for things to happen to them. All of these laptops, I believe, are between 5 and 9 years old. We do have funding for this, and this is a good opportunity for us to kind of get a leg up on the computer replacements that we're trying to accomplish.
So you heard the background for the purchasing of computers. Is there a motion to put it on the table for discussion and approval?
I'll make that motion.
A motion by Diane Cox. Is there a second? I will second that motion. Is there any discussion?
Mr. Chair,
Go ahead.
if memory serves, and I could be completely wrong here, but I believe a few years ago, MIS went through and put all of these items on a revolving capital improvement plan. I was just wondering if I'm remembering that correctly, and how does our expenditure right now for a few dozen machines factor into that plan that was created?
So I do know that MIS did do that on the capital improvement plan. They were looking to utilize that for departments that would not have funding for that. And so because Health and Human Services can tap into funding to pay for the cost of these items, we were not included in that.
Tracy, you said you're getting funding. Is this outside funding, and approximately what percentage are they paying for?
Well, it's definitely a combination for each of the different items. I'm gonna reshare my screen. I think I have a table that shows where the funding sources are coming from for each computer. So in admin, we're drawing upon budgeted funds for 5 computers. And for 2 computers, we're able to tap into some of the COVID funding that we received to pay for those. In behavioral health, we will be able to claim those costs to CCS for 9 computers. And for 1, we will be able to claim crisis costs. So when we get our reimbursement for crisis and we go through that reconciliation, the following year, we can claim those expenses and recoup those costs. 1 computer will be funded by the state opioid response grant funding, 1 by the treatment alternative and diversion grant funding for the treatment court program. 4 computers, we will be able to utilize carryover funding from the children and families allocation that they allowed us to carry over from last year. And we would lose that if we don't have expenses to apply against that. And then in public health, 3 computers will be funded by COVID funding.
Any other discussion? I have a question. Mine would be, what do we do with the older laptops that are 5 years old, 6 years old? Do we sell them? Do we junk them? What goes on there?
Well, if they're still usable in any way, and if they're newer than the computers that are not being replaced, we may recycle them into those. If we do not have a place to recycle them into our own use, we turn them over to MIS so that they can determine if there's a need anywhere else. And when when there really is no use for them, I guess MIS takes care of that, and I apologize that I just don't know what they do with them.
I still think that there would be some value with those computers if they're not used in the county that we could sell and get some money back.
Yeah, very possibly. And I know there's a county policy on how you dispose of county equipment if it's no longer needed. I do know the MIS department maintains a computer lab, and so they may even recycle any of these machines into that computer lab if those machines are so outdated and not really usable. But yes, I agree that there's certainly places where even old computers could be useful.
Is there any other discussion?
So, Mr. Chair, the only other thing I would say that if I do some quick math, let's say we recycled every machine every 6 years between the 5 and 7, that's about 16 machines a year. So we're a little aggressive with this one, but seeing as the funding's there, it's probably a good idea. I just ask that we keep this up every year, around the 15 to 16 machines that we budget for that, or however many we think are going to fall outside of funding, so we don't get behind.
Okay. Let's make a mental note of that. Any other discussion? Hearing none, all those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. All right, thank you for a couple people who joined us. Is there anybody who needs a break right now, get a refresh on some water before we head into our budget talks, or do we just want to head straight into that? Not hearing anything, so I think we can just keep going on to our next agenda item, which is 16, is a review and approve our 2022 Health and Human Services budget.
All right, thank you, Mr. Chair. I did create a presentation to help walk us through the 2022 budget. I guess first of all, I want to recognize the substantial work that was done by Robin before she left, and all of the managers for their time and commitment to develop a budget that I think is very responsible and meets our health and human services priorities. It requires really 2 full months to build the health and human services budget. It involves many meetings between the business and financial manager, myself, and each of the unit managers, as well as several hours of review and analysis of our expenses and revenues. You'll find in your iPad a document called the 2022 Hhs Budget Summary. The county administrator directed each department to provide this information on their budgets. This presentation will highlight the information in that summary, but I've also added this presentation to your iPad folders as well, so you can reference back to it if you would like to. So as I said, the budget summary is something new this year that the administrator wanted all of the departments to provide information in a kind of a more consistent manner. The Finance and Personnel Committee approved the budget instructions in a document called the 2022 Budget Objectives and Guidance. I've also included this in your iPad folders if you would like to look at it. The guidance directed departments to prepare a preliminary budget with no increase in tax levy, but also to incorporate wage increases reflecting the aged pay plan, which averages approximately 6.88% increase to wages, and incorporate a 7% increase in health insurance The actual health insurance cost for next year is not known yet, but that was the placeholder to ensure that funds were budgeted anticipating an increase. And then if unable to balance the budget, the instructions were to make service and staffing adjustments as necessary in order to keep within those directed objectives for the budget. So if a department proposed a budget that would require additional tax levy, the department would then need to decide what reductions in staff or services to make and pull that from the budget. And then finally, the instructions were to provide the cost impact to restore any of those services or staff reductions that were cut from the budget. So that would allow the county administrator and the Finance and Personnel Committee to decide what, if anything, they would approve restoring from the county department budgets. So the budget approval process will be that the budget that's approved by our Health and Human Services Board will be presented to the county administrator and then forwarded on to the Finance and Personnel Committee. The Finance and Personnel Committee will review all county department budgets on August 24th in an all-day meeting. Follow-up meetings might be scheduled to further review or to recommend changes. And then, of course, as the Finance Committee finalizes the budget, it will go to the county board at their meeting in October 26th. So over the last 2 budget years, Health and Human Services has prioritized maintaining our existing services while also working to try to expand the availability of behavioral health services in the community. This budget continues that effort by proposing 4 major goals for 2022. The first goal is the continuation of our current services as well as our current staff. In continuing our current services, when you look at from our aging services, economic support benefits, public health, child protection, youth justice, and services for individuals with disabilities and developmental delays, as well as individuals in need of mental health or substance use disorder treatment, Health and Human Services actually provides needed benefits and services to approximately 25% of Richland County's population. So the community depends upon our programs and services. It's extremely important that we present a budget that does not reduce our services. And so that's what we've put a great deal of our effort into. And then in order to maintain our current level of services, continuation of our current staff positions is also necessary. So as I've said, I think many times, maintaining competent staff is vital to our ability to provide quality programs and services. Effective interventions and service delivery by experienced, skilled professionals helps individuals to remain healthy, independent, and able to participate in the community. When individuals are not able to function and live in the community, there can be a significant disruption to their lives and the lives of their families, putting them at greater risk of requiring more costly care, including care in expensive placements. It's important for the community that we maintain these services that are available locally. I've also shared my concerns about staff turnover. This has been a year of significant staff turnover at Health and Human Services, with the loss now of 13 staff as of mid-August. The most frequent reasons given for leaving include concern about our wages not being competitive, health insurance costs, keep going up, and there's insufficient vacation and leave time benefit for newer employees. So addressing the wage and benefit disparities is vital to improving staff retention and recruitment, which in turn is vital to assuring that quality services are locally available. We're certainly glad to see that directive from the Finance and Personnel Committee wanting to age the pay plan, because we think that that will be one of the things that helps us with our staff turnover issues. The second goal for our budget is to expand treatment court services by implementing a new drug court program. The sobriety court currently targets OWI offenders, but in addition to the negative effects of alcohol abuse, Richland County is also substantially impacted by the drug crisis that is pervasive across the country. Drug court programs have many benefits to the community by helping participants recover from addiction and preventing future criminal activity, while also reducing the burden and cost of repeatedly processing low-level nonviolent offenders through our courts, jails, and prisons. The Treatment Alternative Diversion Program, or TAD, is funded on a 5-year cycle and is scheduled to be awarded to counties and tribes on a competitive basis for the calendar year 2022. So this budget year is our opportunity to take advantage of additional TAD funding to implement a new drug court program, in addition to continuing the OWI sobriety court program. A third goal would be expand the availability of outpatient psychiatric services in Richland County. There's a shortage of mental health and psychiatric services locally and across the region. Health and Human Services currently offers 6 hours per week of psychiatric services. This is not sufficient for our population. Individuals must wait anywhere from 2 to 4 months to get an initial appointment. There are 2 other psychiatric providers in Richland County, but their capacity is also limited. Individuals seeking psychiatric services, if they can't get them here, have to travel outside the area to receive those services. And when individuals are not able to access services in the community, they may be at greater risk of requiring hospitalization or institutional placement. Hospitalizations may become more lengthy if individuals cannot easily transition back to those services in their communities. And then finally, fourth goal is to allocate sufficient tax levy to the placement funds 44 and 54 based on actual historical expenses. As you saw from the placement report documents, we're trending to exceed what we have budgeted in tax levy for those funds. So although placements aren't predictable and they can vary quite a bit, tax levy allocations have not been able to keep up with the increased expenses. Based upon historical expenses and daily rate increases, we think it would be realistic to budget $1.5 million for the placement funds in 2022. I will say, as I continue, please don't hesitate to interrupt if you have questions, but certainly I know there'll be discussion at the end here. So to direct the directive to present a budget that includes nearly a 7% wage increase and a 7% increase in health insurance with no additional tax levy. This has created a significant challenge to our ability to implement these 4 major goals for our 2022 budget. We were able to create a budget that maintains our existing services and staffing levels, absorbs the increased wage and insurance costs, and stays within the tax levy allotment. We accomplish this by maximizing all available state allocations, improving expense claiming, expanding our billing revenues, and taking advantage of other funding resources. But we have stretched our existing funding and revenue projections as far as we can and feel comfortable with. It won't be possible to also incorporate the remaining 2022 budget goals without additional funding. So the following items would need to be removed from our budget in order to keep within the budget guidelines that we were given. So that includes expanding the treatment court services by implementing a new drug court program, expanding our outpatient psychiatric services, the availability of those in the community, and allocating the increased tax levy to the placement funds. The cost impact to restore services to the budget. Additional tax levy would be necessary in order to restore the following items into the Health and Human Services budget. So it would require $15,000 in additional tax levy in order to meet the match requirement of the TAD grant for the drug treatment court program. With additional match, Health and Human Services would be able to request $150,000 in grant funds, which would include the additional funds necessary to implement the drug treatment court and continue the OWI sobriety court. The opportunity to apply for these funds only occurs every 5 years. So we're asking or recommending that this would be something that we would want to request additional tax levy for. It would require an additional $60,000 in tax levy for us to expand outpatient psychiatric services. We recognize this is a large amount, and if we're going to make an ask, I think we're focusing the priority on the drug treatment court, and I would recommend that we defer this goal to a future 2023 budget year. And for us to reach that 1.5 million of tax levy in the placement funds, it would require an additional little over $490,000. This certainly is a priority, and the county administrator has actually instructed Health and Human Services to keep this in the budget along with the necessary tax levy. So you will see a final budget, preliminary budget that includes the full $1.5 million in the placement funds. So this is the proposed budget that we are presenting to you. This is health and this is our what we refer to as our core budget. The placement funds are separate from this budget. This budget meets the budget guidelines and does not include funding for drug treatment court or increasing psychiatric services. I do want to mention that as I explain the differences in the expenses between our 2022 budget and the current budget, you'll note some big variations in personnel costs. And this is partially attributable to the increased cost of step, wage, and insurance expenses for each of our staff. But also it includes how staff insurance plans are budgeted for each department. So whether or not a staff takes a family plan versus a single plan or a no health plan at all. A family plan costs just a little over $18,000. That's the county's portion. A single plan costs a little over $7,000. And we budget based on what plan employees intend to take or we anticipate them taking. We don't budget a family plan for every employee because it would not reflect our real expenses. And there's not a way for our budget to be balanced if we were to over budget for health plans. So there can be quite a variation in personnel expenses based on that. I think currently we've budgeted 45 family plans, 10 single plans, and 6 individuals who would not be anticipated taking a plan. If we were to budget family plans for everybody just to make sure we're covered, it would require an additional $200,000. So that's why we don't do it that way. We do try to plan for any variables where we don't know what that might look like, but that's why you'll see some big variations in the changes in personnel costs. So in the administration section, that includes our administration and building operations unit, as well as our business and financial services unit. You'll see that we do have 129,000, a little over that, in expenses compared to our budget from this year. And that is made up primarily with about 64,000 in personnel increased costs, 20,000 in increased computer and technology expenses, 27,000 in increased workers' compensation expenses. That's a dollar amount we get from the clerk's and administrator's office. And it went up by 27,000 compared to what we had for expenses this year. And about 18,000 in anticipated increased insurance and building expenses. The insurances that are paid for building and various liabilities also comes from the clerk's and administrator's office. And it looked like there was one of the insurances didn't appear in our budget last year, so we're trying to remedy that. When we look at public health, you'll see that there's an additional little over $90,000 of increased expenses there. About little less than $15,000 of that is personnel increased expenses. And a little over 75,000 is due to our COVID response. So that's the contact tracing and vaccinations and prevention activities related to COVID. With the ADRC, you'll see that we have just a little under $34,000 in increased expenses. Little less than 24,000 of that is personnel expenses that are increased, and 10,000 is the increase in transportation program costs that we anticipate. In economic support, you'll actually see a decrease in expenses, and that is attributable to changes in personnel costs. And that's where you can see a big impact of both newer staff being at lower the starting wages, but also fewer taking health plans, or maybe taking single plans instead of family plans, or not taking a health plan. So that has brought those expenses down, even with the other wage increases. It's offset that. And then in child and youth services, you'll see a $56,500 increase in expenses. $25,521 is the increased personnel expenses, and $31,000 is increased contract costs for family preservation. And we're able to tap into state child and family services funding to fund that. And then certainly the biggest increase to our expenses comes in behavioral health, which is our largest unit. So there's an increase of a little over $1 million in the behavioral health unit. Roughly 71,000, a little bit more than that, is the increases to personnel expenses. 21,000 is the anticipated increase in birth to 3 contract services. Those are primarily the therapy services, moving from the Richland Hospital that is ending their contract with us is going to be more costly, but we are tapping into some of the funding sources to allow us to meet that need. And then finally, 958,000 is the anticipated increase in CCS contract services that we would see with both the growth of services as well as how we are funding many of our placements. So like I said, this budget was accomplished by maximizing all available state allocations, improving our expense claiming, expanding billing revenues, and taking advantage of some of the other funding resources that we're able to tap into. But this is certainly the tightest budget that I have seen in my tenure. And we are probably stretching our existing funding and revenue as far as I think we can. I do have more information to share with you. I don't know if anybody wants to ask any specific questions about our expenses. I know there's a lot of information there.
I have a question.
Yes.
So with the wage increases, does that include all employees? Or is that just, does that have to do with the STEP program?
No, what right now, and of course the Finance and Personnel Committee and County Board will decide kind of how this all ends up, but right now the direction is that the entire pay plan will be aged, which means when it first was implemented, I think in 2018, it has not been aged with the cost of living increases since that time. And so aging it takes into account the cost of living increase each year from the time it started. And that estimate is about 6.88%. So the whole pay plan will go up. It does not, all the steps would be raised up by that percentage amount. Is that what you're asking?
That is, yes, yes. Thank you.
Tracy, this is Carrie. So essentially, theoretically, we're not giving a wage increase, a step increase. We're just bringing it up to, say, the cost of living that we should have been doing every year.
That is what the current proposal is. So yes, so if a person is at step 4, they will still be at step 4 and they won't be advancing a step, but step 4 will be 6.88% higher in the wage on that step.
Can you give me an example on like one employee? Like if an employee was getting $18 an hour at step 4 currently, with this 6%, would they be going up $1 or
Yeah,
cents?
So without messing with the percentages, because I won't be good at that. So yeah, so if step 4 is $18, and with that aging of the plan, step 4 is now $19, that employee then will be earning $19 instead of $18.
Okay.
Just to clarify, but that will also help with our recruitment, correct?
Yes, because our starting wage then would be higher. We will, when I did that wage or that staff retention and recruitment presentation, I shared with you some of the comparisons for the surrounding counties. That will put us more right in with competing with those surrounding county wages where they are at. We're still on the low end of each of the surrounding counties, but we're much more kind of in the pack, just the low end of the pack. Any other questions? Okay, I'll continue on. It's just kind of what the placement funds budget would look like. The budget includes the increased tax levy to fund the placement funds 44 and 54. This was the county administrator recommended that we just go ahead and submit those amounts as they put the county budget together. So that was based on what our historical placement expenses have looked like, roughly 1.5 million. We will continue to implement strategies to reduce the need for placements and capture all of our available funding when placements are necessary. So utilizing the CCS program to help fund the community residential placements. You saw that presentation that Miranda did a couple of months ago that really shows the progress that's been made and the savings that we've been able to accomplish through doing that. The other area that I think is significant is utilizing crisis stabilization. In 2019, the state had now fully funded crisis programs if we participate as a region. So through that reconciliation program, we can get 100% of our actual costs for crisis minus maintenance of effort that each county must contribute. Ours is right around 22,000, and we were certainly spending more than that on crisis. So this hopefully we'll see a benefit of how that also impacts funding crisis stabilization in the future. So these are the funds that are assigned to Health and Human Services. The program funds on the top are what make up what we refer to as our core budget. We combine all of this when we give you a budget report, really to show you how our funding fits into our programs rather than each individual fund. So it's not common for us to share fund balances with the board, only because we think of it as one large core budget, not individual funds. And then the placement funds are those Fund 44 for the children's placements and Fund 54 for the adult placements. In terms of capital projects, Health and Human Services does not have any capital improvement projects slated for 2022. The heating, ventilation, and air conditioning or HVAC system for the community services building will be in need of replacement at some point in the next few years. The majority of the units supplying the building are at end of life. There are currently 18 heating and cooling units supplying the building, and 11 are more than 20 years old. There's not a clear timeline when the updating the HVAC system should occur, but the longer we wait, the more the building is at risk of successive unit failures. This project was deferred to 2023 in the county's capital improvements and capital projects plan. So we're anticipating that the following budget year, that would be one of the capital borrowing items. And then some other considerations that I'd like to share with you. So the 2022 budget was accomplished by a lot of effort in maximizing our funding resources. We've stretched existing funding and revenue projections as far as I think we can responsibly do. Unless other funding resources are identified or additional tax levy is allocated, Health and Human Services will struggle to maintain our current level of services in the coming years as staffing and other costs rise. That's important for the board to understand. Although our ability to maintain the same level of services beyond 2022 could be at risk, local public health services are especially vulnerable. Federal dollars through the CARES Act provided the necessary funding that allowed public health to respond to the pandemic in 2020 and 2021. Some of those funds will also continue to be available in 2022, which we've included in our budget. In the state's biennial budget that was recently passed, neither the governor nor the legislature proposed additional allocations for local public health agencies. Public health receives the least amount of state funding to meet its mandates compared to all other health and human services programs and relies the most heavily on county tax levy. As staffing costs and other expenses continue to increase, we will reach a point where there's not sufficient funding to meet all of public health's mandates. The American Recovery Plan Act, or ARPA, provides coronavirus state and local fiscal recovery funding from the federal government, which will provide direct payments to counties. I believe those have already been allocated. So Richland County was allocated $3,350,999 in ARPA funding. Funding can be used to cover any costs incurred prior to December 31st, 2024 to address public health and economic impacts, premium pay for essential workers, revenue replacement for government services, or investments in infrastructure. We were able to balance our 2022 budget without factoring in the ARPA funding, but there may be a use for some of these funds to address public health needs. So while there are many other needs and worthy projects in the county that will benefit from the ARPA funding, Health and Human Services is requesting consideration for some of those funds to be set aside to address COVID-19 mitigation and prevention for 2022 and beyond. We're requesting to set aside up to $250,000 in ARPA funding to supplement the response efforts in 2022, as well as be available to fund public health response to COVID in 2023 and 24. These funds can be used to fund ongoing prevention, contact tracing, vaccine response activities, as well as to purchase the tools and technology that can assist with these efforts. So I'm putting this out there for the board to understand that those funds might help us in future years. I know that there are a lot of potential uses for them to benefit the entire county, and I hope that there'll be some consideration for setting aside a set number of dollars that will stay there for our public health response. So as I mentioned, the approved Health and Human Services budget will go on to the county administrator and to the Finance and Personnel Committee for review on August 24th. This board now has the opportunity to decide what should be forwarded on for those next steps. The Health and Human Services Board's priorities, expectations, and recommendations to the Finance and Personnel Committee about the Health and Human Services budget would be included in that budget summary document that I shared with you, and this presentation is based on. So now is the time for the Health and Human Services Board to decide if you will approve the budget as presented, approve the budget with a recommendation to the Finance and Personnel Committee to consider restoring any of the items that had to be removed, or approve the budget with other changes that this board decides. Whatever motion is made will be included in that document and forwarded on to the administrator and the Finance and Personnel Committee.
After hearing this presentation, what recommendations would the Health and Human Services Board like? I believe it's in our packet under budget summary, correct? Tracy, then you got recommendations that are the cost impact to restore services. Is that what you're talking about?
Yes.
Recommendations? Okay, so there's 3 of them in there. So we have to decide whether we want to do the budget as presented, or do we want to add any more, or do we want to do our own thing?
Mr. Chair, I would make a motion to approve the budget as presented. And I can comment on that when we have a second, if we have a second.
So we have a motion by Timothy Gotchel to present the 2022 budget as presented to the Health and Human Services Board today. Is there a second?
I second. This is Cindy.
Cindy Chicker seconds Mr. Gotchel's motion. Is there any discussion? Mr. Gotchel?
Mr. Chair, yeah, I do want to see increase in program and services or services reinstated, I guess would be a better way to put it. I do believe that our initial crisis is a staffing crisis, and we need to keep positions that we have on the books and honor that 7% increase. I think that is our number one objective for 2022.
Are there any other comments?
I just
I
have
have
a
a go ahead,
clarification
Ingrid.
question. Oh, sorry.
No, go ahead.
Okay.
Go ahead, Ingrid.
So the outpatient psychiatric services, the 60,000, your recommendation was to defer that to the 2023 budget, but I was a little confused. Is that currently in the proposed budget or not in the proposed budget?
No, none, those, that had to be pulled from the budget because we don't have sufficient funding for that.
So then the other two recommended ones, I know that the additional tax levy was in there, but the 15,000 for the TAD grant, was that included in the budget?
No, that also, because we would require additional tax levy, that was also pulled. So it would be kind of up to this board to either say not want to make any recommendations that the Finance and Personnel Committee find tax levy for that, or to request that they, I'm sorry, I kind of got lost in my words, but yes, so it's not in the budget right now. So it would be, the board could recommend that should, they should look to see if they can fund that, or leave it as is, as presented.
And this TAD grant, that 15,000, that was during our public comment hearing where Judge Sharp and DA Harper came and spoke.
That's
And
correct. That's
was
what you were
requesting that we add that into our budget this year.
That is what they were referring to, yes.
So that was going to be my question, was about that, the TAD grant. So it's basically the county would pay 10% because we would pay 15% and the funding is for 150,000.
Yes, just to clarify that a little bit, the TAD grant requires 25% match. But for the current sobriety court, much of that match is made up by in-kind services that we're able to claim, staff time from the sheriff's department, our staff time that contributes to that. But to expand that ask for funding to also incorporate the treatment court would require an additional 15,000. So what you're saying is correct, that it's 10% of what our ask would be, but that's only because we are already anticipating what we can match for the existing sobriety court.
So my recommendation would be, and maybe I can make a motion, is to include the TAD grant in the request for funding. For $15,000, the amount of benefit to the community is so great. I think we all know that drugs are a huge problem in Richland County, and to be able to access that funding, it would be a big loss for us to not invest $15,000 for.
I believe Diane's.
For that type of funding.
So we have an amended, so Diane Cox is making an amendment to the proposal, to the 2022 budget proposal that Tracy presented with us today on the motion that Mr. Gotchel created. Cindy seconded it, or seconded. So there is an amendment by Diane Cox to add $15,000 onto our 2022 budget for the drug treatment quarter, or the TAD grant. Is there a second to that?
Yeah, I'll second it. I think it's very important. I think Diane's right.
So we got a motion and a second to add 15,000, to amend our budget to add $15,000 for the TAG grant. Is there any further discussion on the amended motion? The 15,000.
Mr. Chair, I just to clarify, I think because of the budget direction, it would really be a recommendation to the Finance Committee. We won't be presenting that in our budget, but it would be a recommendation from the board to find funding for that, if I understand the directive from the county administrator correctly.
That is correct that you refresh that. It is a recommendation. They're going to go through the process, see where they're at, and then do add-ons from there. So we're correct on that.
Mr. Chair, that changes my perspective immensely. So if I could recap, we're forwarding on the budget as proposed with a recommendation to find $15,000 for the TAD grant.
Yes.
I would support that as well.
Okay. So the motion that's currently on the floor would be amending Mr. Gottschalk's motion to recommend that 15,000 be added on to our 2022 budget at the end of finance and personnel discussions for our budget. And seconding. So all those in favor signify by saying aye.
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 Aye. Those opposed say nay.
Aye.
Motion carried. Are there any other recommendations that we would like to give to finance and personnel? Okay, so we're gonna be voting on the motion now to send our 2020, correct, Tracy? We need a motion, or vote on the motion to send our 2022 budget with the recommendation to finance and personnel and the county administrator.
That's as I understand it, yes.
All right. Any further discussion on that motion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries. Is there any other discussion within this budget that you feel that should be looked at, concerns brought forward? Okay. With that, then I think, do you have anything else, Tracy?
No, I don't, Mr. Chair.
Okay. Then with that, then that brings us to the end of our meeting. Agenda item 17.
Well, Mr. Chair, as you look to adjourn, I guess the question would be, would the board like to resume attempting to meet in person with that option to attend via Zoom, or would you like to continue to meet exclusively like this using Zoom?
Does the committee have any preferences? I think right now, I think we'll just wait and give it a couple weeks and see what we think. And I think you and I can communicate via email with Rose and include some of the board members with that without violating open meetings law for discussion on that.
Okay, great.
All right. So that brings us down to number 17, adjournment. Is there a motion for adjournment?
Make a motion to adjourn.
Motion by Diane Cox. Is there a second?
Second.
Seconded by Mr. Gottschall. All those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries. Thank you, everybody.
Thank you.
Bye.
Thank you.